Welcome to this Chuff special all about our darling work dog Riley and her recent diagnosis. Riley had developed a mild cough and a bit of lethargy, so I decided to take her in for the local veterinarian to do some testing for common diseases in this area. We're getting Riley a test for Ehrlichia, heartworm and 2 other parasites that affect the blood and can cause severe illness because she's had a mild cough lately. Haven't you, Missy Moo? What are you doing in that bin? Hey? Hey, what a good girl you were, Riley. Will you forgive me? I'm sorry, baby girl. Looks like she's already coming up positive for E. canis, which is Ehrlichia, a blood parasite. I have a weak positive for heartworm as well. There's Ehrlichia, my poor girl. Alright, so Riley has now been diagnosed with 2 different diseases. The first is heartworm, and basically heartworm is transmitted by mosquitoes. So when the mosquitoes bite the dog, infected mosquitoes, they transmit little dirophilaria, these little tiny kind of larvae of the heartworm that start circulating around the blood, and eventually they lodge in the heart and turn into adult worms. The adult worms can then have more babies, but also they grow bigger and bigger and put a lot of pressure on the heart, because as you can imagine, having big worms in your heart makes it harder for your blood to pump. It also can cause reactions and make infections more easy in the heart, and it can also start to affect the lungs as well, so it's a very dangerous disease. The second disease Riley has is Ehrlichia. Now Ehrlichia is a tiny little bacteria that is transmitted by ticks. So when the ticks bite the dog, they inject this little bacteria called Ehrlichia, and it's an intracellular bacteria, which means it enters some of the white blood cells in the dog's body, which makes it very hard for the body to detect it. It circulates around for a while and can cause them to feel quite sick because it's in the white blood cells, but it can also go into the bone marrow. And when it's in the bone marrow, it can prevent the body making red blood cells and platelets. So the dogs can become anemic, and they can also start bleeding because they don't have enough clotting cells to make sure the blood clots. It also can have other effects, such as the body's immune system having reactions to having a bacteria in it, and cause really vague symptoms, like dogs can get fevers, they can get joint issues, they can get a cough, which is what Riley has, lots of different things. So Riley's symptoms are quite vague and could be from either the heartworm or the Ehrlichia. Both diseases are really common here in Costa Rica and Central America, and especially because heartworm preventative isn't used really frequently in tick prevention, it means the diseases do spread amongst the population. So in terms of what we can do about it, unfortunately the medication that you use to kill adult heartworms is not available in Costa Rica, and I've tried to look at getting it ordered in from the States, but it doesn't seem possible. So for now the plan is to put her on a month-long treatment of doxycycline, which is an antibiotic that will kill the Ehrlichia organism, but can also help with any bacterial infections associated with the heartworm, and can also help kill the little baby heartworms as well. I've also got her on prednisolone, which is a corticosteroid, and that's to try and reduce her body's reaction to having these organisms inside her, and especially when we start killing those organisms, her body can have an even greater reaction to them, so it's to try and minimize that. So she's on a month long of that treatment, and then essentially for the adult heartworms, the approach is to basically wait them out. So we just keep killing the babies by using heartworm prevention every month, and eventually in kind of 6 months to 18 months, those adult worms will die, and eventually the body will reabsorb them. Unfortunately, it's not the most ideal process, but it's really our only option here. And so far, Riley is doing better. She's a couple weeks into her course, and she's been eating better. She's been going out and exploring again, whereas she was quite lethargic, and no more cough. So, fingers crossed, she just keeps getting better and better, because we do love our little work dogs. So, yeah, hopefully that explains a little bit about those diseases to you guys. And yeah, wish us luck, send your loving vibes to Riley, and we'll keep you updated in future videos with how she does. Riley, have you been for a swim? Have you been for a swim? Are you a dirty dog? Don't! Joel! Leave her be.
I should do the other one, get dog hair. I'll have a piece of Riley forever.
Ooh, top coat's nearly finished.